Let's be very clear from the outset. This isn't about the healthcare workers. This isn't about the people who actually do the work of healthcare in this state. This is about the multi-million-dollar lobbyists, the multi-million-dollar executives who run these multi-billion-dollar corporations who don't pay sales, real estate, and property taxes, who disguise themselves as nonprofits. Why should you care? The reason you should care, no matter what political party you're a member of, what race you're a member of, or what gender you're a member of, you should care about the massive transfer of wealth that's going on in this state from the citizens to these multi-billion-dollar nonprofits. You should care about that. You should also care when we start talking about these billions of dollars. For example, Atrium has nearly $12 billion in the bank this morning. That is nearly half of the state budget for 1 year.
The state health plan has been on a mission to support and promote healthcare transparency and affordability for years. The report is not published to criticize the hardworking healthcare professionals and support staff that take care of us when we need help. This is about the healthcare system as a whole and the desperate need for change at the highest levels to ensure affordable, efficiently delivered, high-quality healthcare.
Simply speaking, we found the North Carolina taxpayers are hit by a double whammy. The first whammy is that the federal government channeled taxpayers' money to the rich and powerful hospitals, especially here in North Carolina. No, they did not really need the money in the first place. So this is the first whammy, that taxpayers' hard-earned money is being wasted. Right? The second whammy is that these rich and powerful hospitals use the windfall money to engage in mergers and acquisitions, to consolidate their market, to strengthen their power, so that they can squeeze a higher price from private payers and also lobby for more government handout in the future.
Thank you, Julie. So here in Charlotte, as Julie mentioned, we were 88 physicians that left Atrium Hospital in 2018. We're now 105 physicians, have over 180,000 patients. And one of the things that I feel the most discouraged about in regards to this meeting today and why we're having to have it and the report is that the power that's gained by the hospital systems as a result is not only used to strengthen their own market, but it's also used to acquire independent physicians. And over the pandemic, we've seen a significant decrease in independent physicians across the nation. This is a big socioeconomic effect as well, because employers are having to pay more in healthcare dollars, and salaries as a result can't go up as much, and it affects the public all the way to the very end at that level.
We all know that if the hospital goes, doctors' practices will be the next to leave. I, for one, hope the answer can be found right here in North Carolina. And the answer should not be to make our citizens drive 45 minutes to an hour for medical care. You will have to take the information you see and hear today and decide for yourself. Are large healthcare systems getting rich while rural hospitals close?
This is a system that is not paying the taxes for your state or federal. In lieu of paying taxes, they are providing community benefit. And as the work showed, it wasn't spent on charity care. One of my co-researchers made a comment on a hospital that, or this particular entity, that it really resembled a hedge fund with a hospital attached to it.
In 80% of our citizens' lives, especially those that teach, protect, and otherwise serve, in 80% of their lives, they know the value and the price of what they're getting, except with healthcare. When we were talking about the average beginning state employee having to work 1 week out of every 4 just to pay the family premium associated with the largest purchaser of healthcare in this state. So they're having to make a decision between healthcare and mortgage, healthcare and energy, healthcare and food, and healthcare and maybe just living their life. That is completely unacceptable. And the healthcare cartel, which has become more cartelized over the last 4 years, is driving up the cost of health care in this state.